overuse of antibiotics. Intermountain Healthcare is helping the White House to develop a policy to combat this. Here to tell us more about it is Dr. Stenehjem. Thanks for being here today.
Thanks for having me.
And you're from Intermountain Medical Center, so you're part of this team that's trying to help with the overuse. But let's start at the beginning. Why were antibiotics invented? What was their original purpose?
Right. Antibiotics were developed years ago in the 1940s, and they really were developed for skin infections.
Yeah.
So the first use of them were skin infections in military personnel.
Wow, so like rashes or if you had some bacteria?
Yeah, so strep and staph infections were the most common, and that's what the antibiotics were used for initially.
Well, it's just from going to the doctor and talking to folks, it seems like we use antibiotics for everything now.
Right.
When did that switch happen? Why do we see this overuse of it?
We've been seeing overuse of antibiotics for the past 30, 40, 50 years. Ever since we've had antibiotics, they've been overused. And actually, we're still overusing them 30 to 50% of the time.
Wow.
And we typically see the overuse when we treat infections that are caused by viruses and not bacteria. So when people go to the doctor for common colds and get an antibiotic, that's inappropriate, and that's actually caused by a virus and not affected by antibiotics.
So when we have too many antibiotics in our system, when we're using them, what's the adverse effect that we're seeing now?
Right, the biggest thing that we worry about is that when we use antibiotics, that contributes to the development of antimicrobial resistance. So the bacteria that we do get infected with are now resistant to those commonly used antibiotics.
So the germs, the bacteria, they're getting stronger because we're overusing it.
Exactly.
Can't be good.
The bacteria are adapting and developing resistance, and so the antibiotics that we have are no longer effective.
So this is a serious problem. Health issues affect everyone in the country. Why are you going to the White House? What does that partnership look like?
We know that 2 million people a year get infected with these drug-resistant bacteria. Over 25,000 people probably die from these types of infections.
Yeah.
So the White House and the administration has made it a priority to optimize antimicrobial use. They want our nation to have a plan of preventing antimicrobial resistance. And so healthcare providers, healthcare stakeholders from across the U.S. gathered at the White House to help develop this plan.
Great honor to have Intermountain Medical Center, the whole IHC group, to be invited to the White House. What was that interaction like? Are we at the beginning stages, or are we still working through those plans?
We are actually at the implementation stage.
Wow.
The White House in October developed their National Action Plan. That came with an executive order from Barack Obama saying that every hospital needs to have a stewardship program by 2017. And so all of these stakeholders, from the food industry, from food retailers to outpatients and long-term acute cares and inpatient hospitals, came to the White House to offer their commitments to stewardship. These are the commitments that we offer to the nation to say, this is how we're going to optimize antimicrobial use. And Intermountain was fortunate enough to be invited to that.
Well, we're happy to know that our doctors, our physicians here in Utah are on board with this plan. What can the average person do? What can I do to limit this overuse?
The biggest thing for us is expectations. And so when you go to the physician or go to your provider, whether it be a nurse practitioner or a PA, you want to know, do I need antibiotics? And we don't want you going expecting them.
Okay.
And when you go in with a common cold or cough, we hope that you expect that your provider will explain to you why you do or don't need them. We also want the public to be aware that antibiotics aren't completely safe. We only need to take antibiotics when we truly have an infection. And so having that expectation in mind is key.
Have that conversation with your doctor. Sounds like you're saying ask questions and be willing to hear the answer if it's not antibiotics. Dr. Stenehjem from the Intermountain Medical Center, thanks for joining us today.
Thanks for having me.
Still ahead, more from the Good for Utah Road Tour. We'll visit a historic